After a lifetime as an international civil servant, Dr. Monirul Islam is retiring. Dr. Islam is the former country representative for the World Health Organization in Namibia. During his term in Namibia, his impact was felt across the health sector. In this edition of News Journal, we take time to reflect on the life and times of Dr. Monirul Islam, a native from Bangladesh. Welcome and thank you very much for joining us, Dr. Islam.
Thank you very much for inviting me.
Yes. Before we go into the conversation, let's take time to look at your interaction on NBC TV current affairs
Wow,
programs.
that will be nice. Brazil and Colombo, they are saying don't get pregnant.
Yeah.
Now, sex is not going to stop, right? So what we really need to say, it's no use of saying to women don't get pregnant. We need to make sure women has got the right contraceptive measures, right? And if there is unwanted pregnancy, we need to make sure that there is something to do about it. And you have heard of the Canada, they said don't donate blood,
yes.
but it's your social duty, right? If you have gone to that area and you know there is a disease, you must go and say before donating blood, look, I have been there, so please can you check so that you do not infect. So what I'm trying to say, in Namibia, we should not be in panic. The disease is not here, but we are a global village. What we really need to look at is keep our eyes and ears open and improve the surveillance, and surveillance. Go to a restaurant and count yourself. How many people in that restaurant are smoking? The person who's talking about 75%, 70% of revenue, that means out of those, all the people going to the restaurant are really smoker. Now, another issue is look about the tourism you're talking about. Who comes for tourism in Namibia? Europeans?
Yes.
Smoking is going down.
Yes.
And in Europe, nowhere, no restaurant you can smoke. They're not complaining. Those people are coming for tourism here. Japan, Australia. You talk about all those countries where there is very restricted, what is the act there. These are the tourism. You cannot say all the smokers from Europe and Japan and Australia, America, they're coming to Namibia. I'm sorry, it's not true. So let's talk about fact,
Yes.
not emotion,
Yes.
right? Let's talk about fact. Namibia, we are still safe, but in Namibia, we need to be ready.
Yeah.
And good thing is that we do have a emergency response committee and system. So we are ready, and we will be really tackling it, right?
All right. Wonderful. Thank you very much for coming
Thank you very much for calling.
That was the World Health Organization representative in Namibia, Dr. Monirul Islam, speaking to us about the deadly Ebola virus outbreak in certain parts of Africa. Obviously touching a little bit on the signs and symptoms, and then also taking a look at how countries are putting measures in place to try and contain the outbreak, saying that Namibia, a remote possibility of the virus spreading towards the southern parts of the continent, but that Namibia, even though we should not be complacent, do have an emergency a team on standby, and it's always important to know that health-wise, try and take the responsibility personally to make sure that you don't infect yourself. And then, of course, once it does hit, it becomes a more national effort.
Dr. Islam, the interviews on these various platforms reveal a great deal of passion about the health of humankind. I guess as a qualified doctor, it's no surprise for you.
Really, I feel very proud and very lucky to be in Namibia, because in Namibia we could work together. Namibia is a country where they respect you if you're doing something good and recognize you, right? And award you if you're doing something good. So I was very lucky to be here in Namibia, and very proud that what we have done together. It's not only me, it's Ministry of Health, it's also the people, the regions, and also citizens, and particularly the news media. You have also played your role, and it made my life very easier. So I feel myself very proud and very lucky.
Yes. Doctor, we'll talk about that a little bit more, but let's talk more about you and your life story. Where have it all started?
I qualified from Bangladesh, from Dhaka in 1980s, and then I went to a village health complex. I was born and brought up in an urban area, and then going to the rural area, I saw life. Rural people in Bangladesh are very hardworking, very honest people, and they need support. And then I came to Africa, to Botswana. And that transformed my life. I was only 26 when I came to Botswana. And I started a junior, then I became also hospital superintendent, district medical officer. And then I went and joined the Ministry of Foreign Affairs in Holland, and I worked there for 1 year. And then I was invited to join WHO. And there I started in 1992. The last 25 years I was in WHO. That's how my career started. That's how my life started in public health.
Yeah, so something like 35 years as a civil servant, the rest 25 years of it as WHO.
Exactly. Yes. Yes.
Quite fascinating, would you say, Dr. Islam?
I think I do not regret, but I must say that I'm very proud what I have done. And I don't never say I have done, we have done together a lot, right? For the sake of humanity, to help people who need, who deserve our help.
Now, you talked about also your work in Bangladesh, but not as WHO, but did you also not work in Thailand?
In Bangladesh, I worked at the government as a government official, as a junior doctor in a village health complex, and I worked there for more than 1 year. But in Thailand, I was working as a WHO staff. I was the country representative to Thailand. So there are two different countries, two different development issues. The economic development, social development in Thailand is enormous, right? If you look at 1970s, Thailand was almost equal to Bangladesh in development issues. But now, today, Thailand has transformed itself, and economically, socially, Thailand did very well in the health sectors and every sectors if you talk about.
Now, coming from Southeast Asia, Bangladesh and Thailand, as you said, coming to Africa, how did you said it transformed your life completely when you came to Botswana. Why is that, and how did it change you, basically?
As I told you, I was only 26 years old, and so I became a hospital superintendent in Mahalapi hospitals. And you know, in Asia, it's a very hierarchical society, and if you are a hospital superintendent and you are walking on the corridor, nobody will dare, nobody will dare to look at you, right, or even talk to you. But in Botswana, in the hospital, I'm walking because I was in a hurry, and a sweeper who is mending the garden, he will say, "Excuse me, Dr. Islam, excuse me," and I'll stop and I said, "What? What's your problem this morning?" I said, "Why? You didn't say good morning to me." And you know, it just hit me, and I said, he might be a gardener. It doesn't matter, but he's a human being, right? To respect human being, to respect everybody, right? That's what I have learned in Africa. And in various ways, it transformed me. Like I can say I was only 26, 27, I'm very young, and then I was being put into a gynecologic ward, and there comes a 20 years young girl, not married, an abortion case, right? And so I was taking history, and I said, "Excuse me, where is your husband?" And she said, "No, I don't have a husband." And I said, "How did you become pregnant?" Because in Bangladesh, I could not think about it, right? And then it's my boyfriend. I said, "Boyfriend?" And said, then this young girl said, "Doctor, are you okay here?" And it looks like somebody slapped me and say, "Monir, wake up." Because then I realized my birth is not my choice. Somebody choose it for me. I was born in Bangladesh, she was born in Africa, right, in Botswana. It could have been switched. If she was born in Bangladesh and I was born in Botswana, we would have been completely opposite. So it taught me I have no right, absolutely no right, to judge anybody because of their own culture. I have no right to say you are right and you are wrong or I'm right. Because the judging stick we follow to judge anybody, it's mine. It's not everybody's, right? So that's what I have learned, to respect and not to judge anybody, and to really give the respect and respect the cultures, respect everybody. So that's why I say I have learned a lot in Africa, which I wouldn't have learned if I was in Asia or in Bangladesh. So I'm really, really thankful to Africa for transforming me, who I am today.
Dr. Islam, respect goes a long way, and greeting somebody is the most basic form of respecting that person's existence.
Yes, you are right, absolutely right. We should not say because I'm a big person, I'm a president. It doesn't matter. It doesn't matter you are a president or you're a professor, but there are everybody. There's somebody else which is lower than them. They are human beings, and we need to respect every human being equally.
Now talk to us about your appointment to Namibia. There's some story around that as well.
That was something actually. 24th of January 2014, I came to Geneva on executive board. Dr. Kamwe, who was our previous health minister of Namibia, he was there. So DG said, Monir, come to my office. So I followed her to her office, and then DG said, Monir, I have a request. You have to go to Namibia as a WR. I said, all right. When? So I'm talking about 24th of January. She said, by early first week of February. I said, wow. And then told me, go and talk to Dr. Kamwe. DG has already sent my CV to Dr. Kamwe, and I met the Kamwe, and I was really very stunned to see the personality of Dr. Kamwe. And he said, yeah, Professor, I know you, I have seen your CV, I have already talked to the President and First Lady, and at that time Dr. Mwamba was the President, and they are all happy.
That was in 2014, right?
2014, January 2014. And so, and then I came in February, right? So it was all in a sudden, but I was so happy because my young life started in Botswana, and then I realized that my public health life will end in Namibia. It's a full circle in Africa. I love Africa, African countries. I've been to 25 African countries, and you know, sometimes people say, I've been to Africa, but then you ask, which country in Africa? They will say one or two countries. Yeah. Africa is a vast continent. Every country has got its own language, own culture, and different, right? So I never say that I have seen Africa, but I have been to 25 African countries, and I have seen something of Africa, and Africa transformed me.
Well, that's about half of Africa that you have seen.
Yeah, you can say that, yeah.
And you would say that your appointment here, ending your public life here, this is something that had to happen. It was written a long time ago.
Yes, my international public health started in Botswana, in Africa, ending in Namibia with sweet memories, quite learning. So I'm very lucky. I find myself a most lucky person, right?
Dr. Islam, on that note, we take a short break. Hopefully we can pay some bills and so on. We'll be right back after this.
Thank you.
Please stay with us. We'll be right back after this short break. Welcome back to News Journal, where we are in conversation with Dr. Monirul Islam, the former country representative of the World Health Organization. Dr. Islam, the WHO's mandate has always been to provide leadership on global health matters. How far during your term did the WHO come in that regard?
In WHO, I have been to many different positions, right? My career started with global program on AIDS. So I was responsible for sexually transmitted disease. That initial period of HIV community didn't really pay much attention to sexually transmitted disease. So I had to work really hard to push the sexually transmitted disease. I was very happy that Dr. Peter Piot, who was a very known person, he was my first supervisor in WHO.
That's the UNAIDS director.
Yes. And then I was appointed as the chief of family planning and population, right? And there I managed to develop very groundbreaking documents on contraceptive, emergency contraceptive, and all other, right? And then I became a coordinator for norms and standard, and then I was transferred to a regional office in Southeast Asia in New Delhi, where I worked for some years. And then DG then appointed me as the director of making pregnancy safer. That means globally, maternal mortality, newborn mortality was very high. And Dr. Lee, who led Dr. Lee, realized that we need special attention for maternal and newborn health. And that's why he appointed me, and he told me that I need to make this as a global priority, right? And I worked there for really 5 years, and I had a good team. I worked with all the regions, all the countries globally. And we managed to really put the maternal health issues really high. And after that, I was transferred again to Delhi. And finally, I came to Namibia. So all those 25 years, my aim was to really look at the countries where they need our help, particularly the poor people, marginalized people, people who need our support. So I tried to give voice to them for that. And then I always said, there should not be any poor option for poor people. If a rich person can have ultrasound, why a poor person should not have? Why poor should have traditional birth attendants and a rich person should be in a private hospital having a cesarean section? That cannot be. So my focus was no poor option for poor people. We needed to make the politician responsible, accountable for their service to the common people they have voted for.
Because disease doesn't discriminate.
Exactly,
Islam.
exactly. Disease doesn't discriminate.
Yes, and how far did you come with that?
I think we came a long way. If you look at the achievements in maternal health or reducing the maternal mortality and the newborn mortality, our achievement is it's really globally maternal mortality is coming down. It's not coming down as fast as we required because maternal health issue, pregnancy and childbirth is not a disease. It's a normal physiological phenomenon. And it's not a one-shot disease like you have malaria, you have fever, you get diagnosed, you treat, you're okay. But maternal pregnancy is 9 months, and anything can happen within the 9-month period, right? And the issue is that if women today stop getting pregnant, what will happen to humanity? There will be no human being. But the women are giving life to bringing life to this world. That was my another issue. That should not be. Women deserve the best because that's how they're continuing our human cycle, right? So we need to give the best. And I'm very proud that that has really become a global phenomenon. Secretary General, first time a Secretary General talked about maternal health issues, talked about her mother in Korea, how a long time ago they would go to the labor ward, and he said that her mother going to labor ward and saying goodbye to everybody because she didn't know whether she will survive. So, but the things has improved, things has getting better. So, I think I have done something to create that movement and attention for women.
Yeah, maternal mortality has also been a challenge here in Namibia. What is the situation with regard to that?
Namibia, I think if you look at Namibia has done very well in maternal mortality, reduction of maternal mortality, newborn mortality. 87% and 90% of women come to the facility for childbirth. That's a unique opportunity. Women are knocking our door and saying, here I am, take care of me. But maternal mortality and newborn mortality is not coming down the way it should be. It's slowly coming down. Why? Because it's the quality of care. So what we need to look at in Namibia is not any more quantity or excess. We have done excess, but we really need to look at how can we improve the quality. If a woman comes to the facility, we have to make sure they survive, they come and survive with a live baby, right? Because many pregnancies are ending up. Can you believe a woman carrying a baby for 9 months and then the baby is dying during the delivery? This is not acceptable. So it's about the quality. So the focus in Namibia is to improve the quality of care. You know, last year President said this is the year of implementation. And I also say the same thing. In Namibia, there is huge political commitment. Namibia is one of those African countries that allocation to health is the second highest. Right? So there is a political commitment. But my question is that this political commitment needs to match with administrative delivery. Right? How can we really start implementing and implementing with quality? That's what we really need to focus more. And that's what the new minister, which is a very dynamic person, new minister, and the permanent secretary, he's another dynamic person, right? And I really love to work with them. I really had a very good working relation with them. And their focus is also to really see how we can improve the quality. The other issues also in Namibia we need to look at is the managerial capacity. Managerial capacity at the center level, at the central level. And center needs to play a stewardship role, right, to help the regional office. So how do I improve the quality of managers at the regional office? The another one is to look at how do I decentralize. If a permanent secretary is signing for $5 Namibian dollar, he has other things to do. Let it be. You developed a very good standard operating procedures and make sure things are happening. Delegate some of this financial authority to the lower people, but improve their capacity, improve their managerial capacity, and things will improve.
We are seeing it certainly at some of the health centers here in Windhoek, the improvement, Dr. Islam. The other thing is also early in your term in Namibia, there was an outbreak of cholera. There was also then later on there was the outbreak of Ebola. Talk to us about your experience then, and also how did we respond as a nation to these outbreaks?
Thanks God there was no outbreak of Ebola in Namibia.
Yes.
We had this cholera outbreak soon after the flood in northern area, 2013, and we saw that in the northern area there was an outbreak of cholera. And then we saw also that some cases in Katatura also in Windhoek, because there is a very free movement of people. However, WHO, CDC, donor people, the government, the Red Cross, they all came together. We had a team, and really we worked together to contain, and we managed to contain it, and it didn't spread throughout the countries, right? Because it's our collective efforts, emergency efforts, so we managed to do that thing. But we should not be complacent, right? If you look at in Namibia, 1990, in Namibia, we used to have 400,000 cases of malaria every year. It's 9 to 10,000 deaths every year. But 2013, we had only 4,000 cases of malaria and only 4 deaths, right? But I think then we became too complacent, too brave, right? And then we saw 2014, 2015, and also this year, early this year, there is a rise of malaria coming up. So what we really need to look at is that we need to redouble our efforts, because when the diseases are low, your efforts should be much more higher, right? And that should not be complacent. Namibia is committed to eliminations of malaria, but unless otherwise we are really taking action and improve the surveillance system, really. If you are seeing in an area, there is no malaria, and suddenly there is a malaria, you don't wait, you go there and investigate and say why it is so. So we need a really prompt action, and that's what the minister and also the permanent secretary is trying to do. And I was really happy because I had a discussion before the rain with the permanent secretary and minister, and I said, please make sure all the regions, particularly in the northern area, they're all aware of it and they're taking action. And that you have seen in your radio, in your television, you have warned people that please take care of yourself. So yes, we have outbreaks, we have issues, but Namibia is a country where things happen, right? We need some the collective efforts, and that's what happened in Namibia.
You talk a lot about collective efforts. How important is that, the intersectoral cooperation, especially on issues of health?
You know, in Namibia we have seen the communicable disease, HIV, malaria, TB, and Namibia has done very well in HIV, particularly in mother-to-the-child transmission, has come to the zero almost, right? TB is coming down, but we are seeing also that multi-drug resistance TB, malaria has also come down. However, in Namibia, because Namibian likes salt, Namibians like sugar, and then they like red meat a lot. However, the physical exercise is not that much, right? So what we are seeing, high level of cardiovascular disease, diabetes, and hypertension, right? So, and mental health issues also. You see the cancer coming out. So that will be a huge issue. Now, these are the issues Ministry of Health alone cannot do it. Like smoking. Do you think the Ministry of Health could stop it? Because they needed help from the Ministry of Finance, they needed the help from the Ministry of Legal Issues and also industries and other.
Yes.
So that's what we need to look. If we really want to do something now, and if we don't do anything now for the non-communicable disease, the expenditure for non-communicable disease will be so high that we will have big problem. So it needs its collective efforts. And I would say, I would request the President, I would request the Prime Minister, why not we elevate the coordination of doing something of non-communicable disease at the Prime Ministerial level, and better at the presidential level, to bring all the ministries, all the NGOs, all the private sectors, all the donors together now to really do something about non-communicable disease. This is the time to do something.
You talked about the lifestyle diseases also, the hypertension, the diabetes and so on. But it's also a responsibility also to the ordinary, to me and perhaps the ordinary person in the street to take better care of yourself, isn't it?
Absolutely. If you look at the road traffic accident, the roads are, Namibian roads are very good, but it's not for 160 kilometers, right? But people are driving very fast, drunken driving, abuse of alcohol, right? The violence, right? So those are the things also, that it's not only the state which can make a difference, it's each and everybody, but the community, the people would need the proper information, creation of an environment. So the government would inform and create the environment, but individual, families and communities also have the responsibility to take action.
Now, Dr. Islam, during your term also, there had been a lot of groundbreaking work done from the side of WHO, and one of them is bringing that coordination, to improve that coordination among the health parties and partners together. Now, would you say that as the biggest achievement of the WHO during your term?
Yes, this banning smoking, that's a great achievement, and I was very happy, very vocal, but I could not do it without, or we could not do it without the backbone and rock solid support of the previous minister and also the other ministries, Ministry of Finance. And I'm really happy the Ministry of Finance has increased the taxation on tobacco and alcohol. This is another issues, right? So other is achievements in HIV, as I said. Can you believe that 65 to 70% of all the cost are borne by the government? This is another example, right? So, and then HIV is going down. TB, the drugs are from the government. Services are free. Malaria is also. We have one of the unique latest diagnostic facilities in Namibia. Look at immunization. We have introduced 5 more new vaccines, and we managed to do that thing. Last year we had a campaign of measles rubella campaign. Our target was 1.8 million population, nearly half of the population, but we managed to vaccinate 1.9 million. And it happened because of collective efforts and everybody joining together. And also the community also joined together, right? I did talk to, in the street, I like to talk to people what is really happening. They said, no, we got the information and this is our duty to do. And so I brought my child, I brought my people together, and we came for vaccinations. So it was really a fascinating experience I have in Namibia.
Dr. Islam, we take another break. We're going to pay the bills again. Please stay with us. We'll be right back after this short break. Welcome back to News Journal, where we are in conversation with Dr. Monirul Islam, the former country representative of the World Health Organization. Dr. Islam, before the break, we talked a lot about your work life. But tell us a bit more about what would be your most striking memory of Namibia, away from work.
Namibia is a stunningly beautiful country with beautiful people, right? And such a smooth political environment, right? You have the seaside, you can go and see dolphins, the whales, and you go to Hunters Bay and you see the thousands of wells. Then you have the beautiful, most beautiful sand dunes. You have all the animals here, right? You can go and see all the fives. And then you go to the second highest Fish River Canyon, and I was really so glad to swim with the fish in the Fish River Canyon, right? And it's a beautiful country. It's a nation of the brave people, right? And people are very nice. So it's not the work-wise that I was happy what I have done, but to see Namibia, Himba populations, right? It's so wonderful. Your culture, diverse culture issues here. And this is all fascinating, right? I met the San or the Bush people in Namibia. Then I saw people here, right? They are beautiful people, right? So it's a, as I said, it's a fascinating experience for me, work-wise and also in the social wise. And I had really had a very good relation with most of the ambassadors, right? They came to my house, I went to their house, we had a nice discussion. Although we didn't talk about politics, we talked about development, but we had really fun. So I had a really, really good 3 years in Namibia.
A very fulfilling time, Doctor.
Yes, it is.
But talk to us about the 35 years of your international career, your career as a, what is the most important thing that you take away from it?
You know, in my 35 years working, I've been to 92 countries in all continents. I've seen different people, different cultures. And every time you go somewhere, your eyes open, you learn more, right? By talking, keep your eyes and ear open and listen. So that was a really good thing. And the most fascinating, and I'm very proud of myself, if I have to remember only one thing, is that my contribution to make the pregnant woman's life, the poor woman's life, the newborn life, to make it a global agenda, make a movement, and that's fascinating, particularly also the young adolescent people. This where I want to really thank our previous First Lady, and particularly also the present First Lady. She's a wonderful lady. She's very articulate. She knows what needs to be done. And her passion for the adolescent people, it's tremendous. So those are the few things I feel very proud that I managed to do something about it.
Now talk to us about what will you be doing after your retirement. Certainly not only enjoying the sunsets.
I like teaching, and I teach in Thailand, I teach in Japan, in Tokyo University, I also teach in UK and US. So I have, you can say, almost started a job in a teaching university in UK. So I will be retiring, but I'm not tired yet. Yeah. I think I can still contribute, and that's what I'm going to do.
Now, Doctor, we also have it on very good authority that you are a mean cook yourself. What's your specialty? Yeah,
you know, we are 5 brothers and 2 sisters, and so our eldest sister was always in the boarding school, so sometime if my mother was sick and other things, and I had to take off, and my mother taught me how to cook. So I learned how to cook, and it's a passion for me. And I fuse with Indian cooking or Bangladeshi cooking with other Thai or European cooking, and I like cooking. And at home, when my wife invites people, it's always me who is cooking, because people comes to my house to enjoy my fusion cooking. So that's a hobby, and I like it. I like it. I spend a lot of time in the kitchen.
Right. Now, what's your?
But when I cook, I don't allow anybody to come there. Right.
Yes. Too many cooks spoil a good.
Exactly.
Yeah. Dr. Islam, what is your take on healthy eating?
You know, it's not only the eating. We always talk about eating. We don't talk about what else we do after. For me, it's intake, it's input and output, right? If you're only eating and sitting in front of the television and watching television and not doing any physical activities, that's not we need to look at. So we have to balance what we eat and what is our output, right? But I think it will be good that when you are young, you need more protein and carbohydrate type of diet. But when you're growing older, it should be more white, lean meat and also less sugar, because your body cannot cope. So eat healthy and have a lot of young green vegetables, fruits. We can say that, like, you know, most of the poor people cannot afford fruits and other things. But then there is a greeneries also, right? And then try to avoid fast food, because there are a lot of fast food here. I was really surprised to see in Windhoek, when I look at the brochure, I said, in Windhoek, 110 restaurants here. So people like to go out, but go out with the fast food limit, and don't drink too much of fizzy drinks with a sugar level. Look at how many cans here. 1 spoon of sugar is enough for the whole day. Your body needs, your brain needs sugar, carbohydrate. But look at it, and don't abuse alcohol. Don't abuse alcohol. Do physical exercise as much as you can.
Now, Dr. Islam, as we conclude our interaction, very engaging interaction here, would you look into that camera and just tell Namibians last words, your final words to them?
I feel myself very lucky to be here, because Namibia is a fascinating country, it's a fascinating people. Namibia, where things happen. And I'm so confident with the political commitment. What I really want everybody to take part in it. And now we need to move from political commitment to administrative deliveries, but each and everybody needs to contribute. Namibia, where things happen.
Dr. Islam, it's been a real pleasure being in your company. Thank you very much for having made the time.
Thank you very much, and I'm really glad that NBC played its role. I want to thank you, and I'm very proud of NBC, what you have done.
Well, thank you very much also. And with that, we had come to the end of our very engaging conversation with Dr. Monirul Islam, the former country representative of the World Health Organization. From me and the rest of the crew here in Studio 2, it's goodbye until next time.